electrodes, that two rods. They're
Yes.
placed, they're held, so they're placed on the skin,
Yeah.
and they're hooked up to a machine. I use a Syra, but there are many such devices. This is the
Yes.
machine, and it's hooked up. There's a wire at the back, and they're hooked up, and this reads the energy wavelengths coming from the body on a computer. This is all hooked up together.
Shakiba here is a powerhouse of knowledge. Now, Shakiba's always had a passion for helping people, and she was a student of medicine, actually. And then she got veered towards homeopathy and nutrition and bioresonance. And now the way she works is normally she combines homeopathy, nutrition, uses her bioresonance machine, which she's going to tell you all about, and people have incredible results. How would you explain this bioresonance, which is so difficult to explain to?
It is a therapy that uses a device, and there are many devices as such of the bioresonance that measures the frequency of energy wavelengths coming from the body. These measures are used to assess imbalances in the body systems to achieve the desired result. It is based on the idea that unhealthy cells or organs emit altered energy and in waves, and these are called electromagnetic waves.
Yes.
The detection of these waves can be used to identify and confirm the imbalances in the different systems of the body. And we change these waves, that's the whole idea of bioresonance, to their normal frequency, and this will achieve a desired result of a state of health.
Yeah.
Which are two electrodes, that two rods. They're placed, they're held, so they're placed on the skin, and they're hooked up to a machine. I use a Syra, but there are many such devices. This is the machine, and it's hooked up. There's a wire at the back, and they're hooked up, and this reads the energy wavelengths coming from the body on a computer. This is all hooked up together. The energy frequencies can be altered by the machine for the body cells to vibrate at their natural frequency. That's what we are striving at, because something has gone imbalanced, and that's why you're experiencing the symptoms.
Now, Shakiba, do you have any scientific evidence? Can you share it with our audience, because that really gives people confidence?
Exactly. And you know what? I actually myself was a bit skeptical, because I've been a homeopath and a nutritionist for many years.
Right.
And I went to one of those fairs where they are selling a lot of new equipment that comes out. And one of the things that was there was this device. And I just sat there and I held the rods, and I just couldn't believe what was coming up. I didn't even talk to the practitioner about my symptoms or anything. Right. And a lot of my symptoms came up there. And I said, what is this device?
Right.
So I rented it for a year, and it just was miracle machine for me in my practice. So so that is my experience. But the scientific evidence, going back to your questions, has its roots in the 1970s with Dr. Franz Morel, who's a German medical doctor who uses homeopathy in his practice. And homeopathy is based on the actual belief that like cures like. So the similar substance is given to the patient client, and that achieves a desirable result, because then the body frequencies are at their normal level. And it's based on the fundamental concept that water has memory. This is a very important part in homeopathy. So Morel wondered that if it might be possible to develop a kind of electronic homeopathy by using electromagnetic signals coming from the patient's body, because body is 70% water, right? And so information should be stored in there if the water memory theory was correct. So that's how this came together with his engineer son-in-law and the biophysicist Dr. Ludger Mersmann. In 77, they developed a filter system to separate the unhealthy and healthy electromagnetic signatures coming from the body. And then these rods were placed on the skin, and they did a lot of experiments, and it just was a wonder machine. Basically, I want to say one more thing. It's a tool to enhance your overall assessment and treatment ability. And it is just not the only thing that's to be used. After an extensive consultation and case taking, then it is an added tool to sort of either confirm or give you more information.
Okay, so like what you do, like, you make people fill in forms and then you do a consultation about their nutrition and their homeopathy and all that, and then you do bioresonance.
Everything. And then in the last bit, I will use this device.
Right.
And then this will confirm. And many times it happens that the client says, I never told you that. And how is this
Yeah,
picked up
yeah,
my symptoms? For example, the other day, a lady came and she said, I never told you about the pain in my back.
yeah,
And it came exactly L4, number 4, and when I pointed there, she said, that's exactly where my pain is.
yeah,
So it picked up those altered energy issues there.
yeah.
So this particular client had gone to a health farm, and he said that there were vials and vials of blood that they had
Yes,
taken,
yes,
and they went through extensive testing and a fortune, and
yeah.
he came and showed me the results. And when we did the bioresonance, the Syra on him, it's very similar readings.
What areas have you seen the most success? What conditions have you seen maximum amount of success
So
in
as
your
a
work?
nutritionist, my main aim is my focus when the client first comes to me is the gut, because if you are not absorbing and any nutrients, your body will get weakened and the systems will get weakened. So
Right,
I have that's where I concentrate, and I do see a lot of improvement there. And once that improves, the symptoms are shown up on the skin or various other issues such as sleep, such as energy, lack of energy, anxiety, all that will come because of lack of nutrients. And the
right.
most important thing is environmental factors,
Mm-hmm.
which are influencing the body. So
Right.
those have to be addressed. But I have seen a lot of improvement in gut issues, in sleep issues,
Mm-hmm.
headaches, low energy, anxiety, because we look at, as homeopaths, we look
Mm-hmm.
at the causative. Even in nutrition, there's a lot of strive towards functional medicine. That means to look at the cause rather
Right,
than the actual
right.
only symptom that the client has come with. So the anxiety has been a cause of a lot of, like, some people may come with serious skin issues, sleep
Mm-hmm.
issues,
Mm-hmm.
and those are actually going back to the emotional stress that's happened.
And have you had conditions where it hasn't worked?
So I can't say it hasn't really worked in conditions. I think what's happened is that, what I need to be very aware of is the serious pathological issues that people have, long-term issues, for example, heart, thyroid, cardiovascular, other issues, so those have to be medically treated. And since I was studying to be a doctor, I know a lot of the allopathic medicine, and I know when to be, the client needs to be referred to the GP, and we also
Right,
train to do that. So I
right,
will work together. So my idea is to have an integrative healthcare. So to work with the doctors.
right.
So the client will come. She's got a thyroid problem, yes, and they're suffering with more symptoms. But I will never tell them to go off their thyroid medicine.
Right.
I will help them with the symptoms they come with by looking at the causative factors. Many
Okay.
times it's side effects of the drugs that they're having.
And also, like, since you're a nutritionist and a homeopath, are there situations where you find that the bioresonance machine has actually contradicted your findings?
In fact, quite the opposite. I
Right.
was first a homeopath for many years. I qualified as a homeopath in 1997 from Regent's College.
Wow.
And what happened was that the following years, I was helping clients. And what would happen is that I would just give general nutritional advice and they would get better. So I said, let me get a proper qualification in that. So actually, they complement each other. So the homeopathy with the right diet and lifestyle advice, that's the way forward.
And do you find that the machine normally confirms what you're saying rather than contradicts what you're saying with your clients?
It always
Right.
confirms and gives me added information. So that helps me. And what the machine does, it also, there's something called a whole tank where
Mhm.
all the symptoms come up. And next to that is the advice. There are many already supplements which are programmed into this machine. So it will
Right,
give me
right,
the advice what to do. So then it's up to my discretion which brand to use and what to use. And
right, right,
because I've already taken an extensive case taking. So
right.
I will then decide how to put the diet and lifestyle advice together.
Okay. How do you help people once you've got all this data about them? They've told you, you've used the machine. Then how do you help people?
So basically, I get all the information together and
Yes.
I will write out maybe 5 or 6 kind of things for them to change.
Okay.
Which has come out of the Asira. And also, I don't know if I showed you this little bottle. So
Yes.
this is played on this hardware here. that I showed you, the Syra.
Right.
And basically this will be a custom-made remedy for you, because the symptoms that has been picked up by the Syra will be imprinted onto that.
Okay.
And there's water there. Water has memory. The electromagnetic signatures will go in there. So this will be your homeopathic remedy which you go home with. So this will be, you'll take this home. Then I will write a report of all the changes that I recommend to you, and
Right.
which would have been discussed in practice, that whether they are possible for you to make those changes.
Right.
And then a little bit of a supplement advice.
Right.
I don't really give too many supplements. I rather go towards changing foods, because I'm also a naturopath.
Yes.
So what happens, I'd rather do change the food, give you more food advice and diet and lifestyle. And inevitably there's mental stress involved. So we will discuss that, while whether to do mindfulness, whether it's yoga. So it's a combined holistic approach to improve the client's health.
And also, Shakiba, do you want to tell everyone about like the food sensitivity test?
Very interesting. It is this Syra, because what happens, there are many tests that one can perform. But the first one that I always do is called a comprehensive analysis, where it will pick up the general imbalances in your body systems. That is when I make the drops. The second one I always do, that is my way of practicing. Many other Syra practitioners may do differently, but I do a food sensitivity test. So what happens is that I will do a second test where I will press that test. And food sensitivity test is not, I mean, you can't say it's an allergy or intolerance. It could be either, and all of them will come. It's a signaling system of red and yellow. So the yellow is more stressed and the red is a little stress. So I will advise you to either give up the food or cut down the intake of certain foods. So you will go home with that sheet. And this is not forever, because the whole idea is to balance the body.
Yes.
With the Syra, with the advice, and with the nutritional advice. And once especially the gut is improved, then hopefully you can have those foods after a couple of maybe 6 weeks or a couple of months, and reintroduce in a gradual manner.
So would you recommend people come back to you after 6
Absolutely.
weeks to 2 months?
Absolutely. A lot of my, there's one client in particular. So she came with me with issues of fibromyalgia and extreme weakness. And what happened was I changed her a lot with the diet and the lifestyle. And then she just believes so much in, now she knows how to read these food sensitivity sheets. And every 6 weeks or 2 months, she will come to me and we will go through it quickly, the follow-up, and we'll do the food sensitivity. And she changes her diet. And she really feels that it improves her when she follows that advice.
So you would say it takes about 6 weeks to see some sort of initial result. Is that right?
So some people see results almost straight away, because what happens when you hold the rods, you're actually getting frequencies back into your body.
Yes.
What happens, already the frequencies are trying to balance you, and then you've taken home the drops. So what happens is that some people get balanced pretty quickly. Also, maybe it depends on how long that particular symptom that you come with has been imbalanced.
Yes.
So there are many factors. So some people are, like they'll say the next week, oh my God, I'm already better. Some people after 6 weeks will say, yes, that is better, but not that. And so, you have this, it's a continuous, it's very individual based.
Will the bioresonance machine, you think, ever replace medical and alternative doctors?
I'm not sure. Alternative doctors, I'm very much for, but the medical never. No, we have to work together. The whole idea of the of medicine, of getting people better, is an integrated way of working. The doctors should be working with people like me, so that we work together. So we look at the causation. We look at more into the food, the diet, and the gut, and which the doctors actually don't have time to do. They're doing their job, and you'll come with a symptom, and they'll give you medicine for that symptom. For example, a headache.
Right.
And they will give you a painkiller. You come with a fever, they'll give you something to reduce the fever. But we will look at the cause. Why is the headache there? Maybe it is a mental or emotional issue. Maybe you're not getting enough sleep. So we really go deep into it. Each consultation with me, the first one would be an hour to an hour and a half. With an extensive case taking.
Do you have any advice?
So my advice would be to follow the diet and lifestyle advice, and that is tailor-made to you. And not just read everything in the newspaper and start following that. Like a lot of my clients, they'll my friends, they listen to their friend, oh, that is the best thing to have, let me have that, like for example, something like glutathione. It's an antioxidant. It's a new thing that people are actually doing IV with, and they'll start having that. Maybe you don't need it. I mean, you need to see many other factors and not just go for the fad that is out there.
How does one stay immune?
The thing to do is mind over body. I mean, you have to be positive and see the good in what's happening, that what is coming out of this time, right? So if you stay positive, that is the main thing for me. I always work first with the mind, and then of course with the body there are certain vitamins like vitamin C. There is multivitamin, zinc, all immune boosting supplements I would give with that. But basically the mental, emotional understanding and relaxation is key to this.
Are there any side effects of using this machine?
Not at all. Absolutely none. Absolutely none whatsoever. There are no side effects. If it doesn't help you, it's not going to be doing any harm. And such is homeopathy.
Can we compare this machine with Ayurvedic pulse reading?
It's different. It's different, but I guess you can compare it, because pulse reading is energy based, and you do feel the pulse. Yes, I think you can. I am also qualified as in Ayurveda. I've got a degree in Ayurvedic. Yes. So I do know Ayurveda, and I didn't do pulse reading. I was working more with the doshas and advising with that.
But that's a good way of looking at it, whether it's pulse reading, whether some people read, the cranial fluid.
Yes, yes.
That's a good.
Some of the devices.
Yeah.
Some of the devices actually go on the head of the bioresonance. So this is the one I chose because it's made in the UK. Yeah. So the updated version of this is something called Kest 4, and that has got the rods on the side, but it works very similar.
And can the machine pick up serious illnesses?
So it may give me imbalances on that, and if you keep coming back to me, it will keep giving me imbalance. So then I can recommend. I will recommend you to go to a GP and do. First of all, you have to come. When you come to me, you fill a complete questionnaire, and I do require a blood test report. So I will pick up things from there. And then if there is some sort of inflammation and there's high CRP or I can see high white blood cells or anything like that, I will refer you to a GP. So that's his forte.
Fantastic.
So I can pick up some things in the blood report and then recommend you to see a GP.
And what do you do for balancing gut health? Is that part of your approach?
That's my first approach. That I would do a lot to do the gut imbalance, because the Asira would pick up generally something to do either with the colon or the stomach or digestive issues, and then I would definitely help you to balance the gut. Gut imbalance is known as dysbiosis, and that is key for improvement in any symptom you come with.
Lovely. So maybe you want to talk a little bit about how you've helped people with hormonal imbalances, Shakiba?
So hormonal imbalances have got to do a lot with estrogen, progesterone if it's a woman, or testosterone if it's a man. And there are, I will ask you extensive questions about it, and then advise you to the right diet and lifestyle and the supplements you need, and also give you the Asira. But I can help you definitely with the hormonal issues. There's a lot of excess estrogen which also comes through plastic.
Wow.
Those are called xenoestrogens. So never leave a plastic bottle in the car. The heat of the plastic can get into the water, and you get something called xenoestrogen. So there are many other environmental factors which are causing dis-ease. I don't call it disease, I call it dis-ease, uneasiness, right?
And the first general test that you do picks up on these. Does it? Because
the first test, something is called comprehensive analysis, and that will give me a really comprehensive picture of what's going on. And then we can pick up on that and do specific tests. There are many tests that we can perform, and as you keep coming to me, and the next so basically you come with many layers, and that's what homeopathy is also all about. So you will come, I will get the surface layer out, and we need to get to the core, which is a healthy state. That can take time, or it can be in a few months, a few years. It can be anything.
And do you have any advice in menopause, especially with weight gain?
Absolutely. Menopause is something that the ideal thing would be to come to me when you're it's before menopause. That's called perimenopause, or even
Yes.
before. So then
Yes.
I will give you diet and lifestyle according to the right guidance. For example, I tell you to have flax seeds. Flax
Mm-hmm.
seeds are full of phytoestrogens. Phytoestrogens are plant-based estrogens,
Mm-hmm.
which take the place of the estrogen. So the menopausal symptom comes because there's no estrogen.
In the
So
body.
if you have plant-based estrogen, they take the place, and then you don't face so many symptoms.
Mm-hmm.
And weight gain is one of the natural thing that happens. And I would give you, because what happens, the metabolism goes slow.
So can the rest be done online for those who live abroad?
Yes, I think I would probably do a Zoom call,
Mm-hmm.
and that I could see the client, because for me the body language, the look, all that is very important, because that's my homeopathic training. And then we definitely could do it long distance, and we could do Zoom calls and follow-ups. Like in between the Zoom calls, you can write to me anytime and you'll get an answer.
A lot of people at the moment are going through anxiety, right? So can you give us examples of how you manage to help people?
Okay, but basically anxiety, it's a lot to do with the talk that happens in the room. So basically I'm almost like a counselor, because they'll talk and then I'll give them measures to how to relax. So for example, I would give mindfulness advice, the little bit I know. I'm sure there are many practitioners who may be online who are qualified in mindfulness, but I'll give you an app to listen to. And then I will tell you to do more yoga, more relaxation, and tell you to take time out for yourself. So basically, rather than just be in the house and be cooped up, go for a walk, listen. So there are many different tools you can use to overcome anxiety. The main thing is to actually identify where the anxiety is coming from, and then talk it through and look at the positives rather than the negatives.
Should flaxseed be consumed whole or roasted or powdered?
So powdered, for me, powdered is the best. And once you open the packet, you put it in the fridge, because it goes off. And 1 tablespoon per day.
I also have flaxseed oil, which is what Mayor recommends.
So flaxseed oil, because flaxseed is full of omega-3.
Yes.
And omega-3 is an essential fatty acid which we don't get through the diet. So if you don't make a conscious effort of having the natural omega-3s, you will be low in it. And omega-3 is really important for the brain, for the cells, for the cell membrane to be supple, to get the nutrients flow. So there are many factors. A lack of omega-3 can cause serious issues.
Is turmeric good to have in powder or tablet form?
So depending on how pure the powder is. I have it myself in a tablet form, because what happens is that the active ingredient, which is curcumin, is concentrated in a tablet form. And that's what you're having. But the thing is to have it from the right supplement company. So as nutritionists, we know the right company. So I will recommend you all the right ones. And I like to use the food state companies, which are made from the actual food rather than synthetic.
Rather than chemicals. Would you mind sharing supplement companies that are high quality?
So Cytoplan and Wild Nutrition. These are the ones which are food state, and they are my favorite at the moment. But there are many others, but I'm not here to advertise supplement companies, so it won't be fair.
Thank you, Shakiba. That was such an incredible talk. Thank you for listening to this chat. If you enjoyed it, please subscribe to this page. Please subscribe to our podcast on Apple and Spotify, Wellness Curated, and follow us on Instagram, Wellness Curated, the number 1. Thank you.